All right, so lots of review from yesterday, right? We learned a lot yesterday with the cardiac or cardiovascular system, to be more true. So we'll just start with review there. We talked yesterday about what is it called when you're listening with your stethoscope? Auscultation, awesome. And the things that we hear with auscultation, do you remember what the first sound is? Glub. And then the second sound? Dub. Now, what does that actually represent? What is the first sound, love, representing to us? The closing of the AV valves, which is your tri on the right and bi on the left. What? Okay, cool. And then our second sound is the closing of the semilunar valves, which are the which two? Very good. Awesome. Okay, so we want to make sure we know that. And then remember that picture we looked at yesterday that had the veins next to the arteries? Which one had more muscle? The arteries did. The arteries did. Now the veins still do. And what did we say that muscle does for us? To dilate and contract, right? To get bigger or to get smaller. Okay, very, very good. What did we say is our largest vein in our entire body? The vena cava. And which is the largest artery? The aorta. Very good, you guys. And then we have the valves. The valves, I know, they're kind of tricky because we have 5 different names for all of them, right? So we'll just outline it today in our notes a little bit different maybe than what we did yesterday. So what is our right AV valve called? The tricuspid. Again, found on the right side. And then the left AV valve has 2 names. Bicuspid or mitral. And again, if you remember, we always start on the right side of the heart and then we move over to the left. That's how we can remember tri before you buy my jeans, whatever. Okay? You guys feel a lot better of a handle on that than maybe yesterday at this time? Okay, good. Good. I know it's a lot. I know. All right, what are these small arteries called? Arterioles. And venules. Okay. Because we always like connect stuff to food. Do you guys know, you all know ravioli, right? But you know smaller raviolis are raviolos? There's like mini raviolis? Yeah. So O's. And then what are the steps of our cardiac conduction system? We all know step number 1 is? SA node. The next one? AV node. The bundle runs down what structure? Yeah. And then lastly, and he runs up what section? The ventricle walls. Very good. Very good. All right, let me double check our fun stuff cheat sheet. Your heart beats how many times a day? Yours, not our cats. Just be quick. More than 10,000.
A million.
115,000 times. 115,000 times.
Doesn't that depend on how many times your heart beats per minute?
Definitely, that's how you calculate it, for sure. Yep. So if you want to do the calculations of about 80 on average, or Google it, because that's where I got these.
The average is between 62 and 85 per minute.
We'll do the math then. How many gallons? Of course, this isn't how many gallons you have in your body, but in terms of pumping action, more than 50.
2,000.
2,000 it is. Did you
really?
just Google it?
Wow.
You did, didn't you? You did. So 2,000, and again, that's not how many gallons we have in our body, but just how many times it would be.
How many gallons do we have in our body?
I don't know that. I don't know that. So I do know, and this is something you'll learn. So I guess again, you have to do the math. Your body weight, 8 to 10% of that is blood of your body weight.
1.5 gallons.
You can safely take
That's it?
about 8%.
It seems like it should be more.
Yeah, there you go. Not terribly much, right? All right. So who wants to go first? First row, second row. Second row. So you guys are going to be working on what we, in first row, they don't get lucky, they're going to do the same thing eventually, or first group rather, and walking yourselves through the pathway of the heart. So remember yesterday how we said that's really the big goal by the time we end cardiovascular system, is be able to say, we start in the vena cava, next step. So that's what you guys will be working on collectively today. So second half, adios, hasta luego. Yes, Taylor. What? Well, no, but right here where we say it's the try or buy, the buy is the same as the my. It's the same gap. So your notes aren't wrong. I would just maybe put my in parentheses because that was in the next.
And that's what the lab is.
You want this or that?
That's fine.
I want to know.
So, and that's where I want you to have this in your notes too, because if you know that both of the AV valves are the cuspid valves, then you just need to know, is it tri or bicuspid? You can leave mitral out of this equation, but just know again, at the end of the day, the left AV valve has 3 freaking names. And you need to know they are all his names. Somewhat like the linea alba from last week, right? It's 3 names.
So is there 4 valves total on the top?
There is 2 valves in the middle.
It's a new record.
Hang on, Dom, I see you.
Why do they like to confuse us?
There's a valve right here and a valve right here. Those are the AV valves because it is breaking up the A and the V's. Okay? If you want to think of it, we have a pulmonary valve over here
Okay, so
that comes from this valve, and then we have kind of an aortic valve up here.
Gotcha.
So there's 2 at the top, 2 in the midline.
that helps.
Very good. Yes.
There's a new show on Netflix called Cells at Work, and it's about red blood cells and white blood cells in the body and how they work. And in one of the episodes, the red blood cell goes all the way through the heart
Good.
and does a full circumcision.
Sweet. So you'll want to have that memorized. We did a lot of that yesterday, but we'll pick back up on that today.
Oh, I was like,
Oh,
not the heart.
What?
Meiosis, everybody.
Oh, come on, everybody. I'm gonna pull this baby back up here and do a little bit more of a heart review. Make sure again we really have this down before we move on. Oh, I don't have a little laser pointy, do I? I'll have to try to jump and point. All right, so just kind of as a review, we'll just go over a handful of slides and again try to really make sure that we're super familiar with all of the structures in most of our illustrations. So just to start us off here again with the conduction system, remembering that this is the electrical conduction system of the heart. So this is, again, separate from what we consider the innervation of the nervous system, right? Yes, there is some nervous system that comes into play. But again, you'll see your SA node at the very top right atrium, And that's important, again, just to make sure you know your chambers. So right atrium, left atrium, right ventricle, left ventricle. Because the question could be, in what chamber of the heart does the SA node lie? You can't just say it's atrial. You have to be able to say it's the right atrium, right? Okay. And then, again, he's going from the sinoatrial node to the AV node. The AV node lies in that kind of wall where, again, we have the breakup or the division of the atria and the ventricle. And then he's going to go down the septum, like we said, and back up the walls of the ventricle. And if we remember, again, every chamber contracts when we have this electrical conduction, but they're not all contracting at the same time. All right, and then you'll remember your words for contraction and relaxation. Remember, this comes into play with what other system we kind of talked about yesterday? The blood pressure, exactly. So these are, again, terms that kind of go hand in hand when we talk about the actual pumping of the heart and then the relative pressure within our cardiovascular system, or the veins and vessels themselves. So your systole or systolic is the contraction. Diastole, you'll remember, is the relaxation. What did we say is flatline? Asystole. Very good. Very, very good. And then this is what we recovered again today with our board stuff. So Taylor was just concerned a little bit. She was like, oh, my notes, they're wrong. Well, she's not wrong. Just the way that I noted it on board is keeping my cuspids together. So my tricuspid and bicuspid. Again, just pointing out that that's the one that has 3 different names. Did anybody read in their textbook why it's called mitral?
It's the hat.
The Pope hat.
Yeah.
The mitre. Exactly. It's important to read your texts. I'll just leave it. Good job, Desiree. Very good job. Good on you. And that's why, because of the shape of the valve. So this picture, I'm going to see. Oh, this is the bastard that's all reversed. We're going to make him bigger, though.
Are you recording today?
Huh? I am
You're not recording, are you?
I am recording.
Oh.
I've given up already. I've given up already on the clean mouth. It makes lectures boring, right?
You're right.
So again, remember that when we look at the heart, how do we want to be oriented to it? Right side, right? Over on this side. So it'd be like this, again, shaking the right hand. This picture, again, you guys brought this up yesterday, is backwards. It's flipped compared to how we've learned it. I think this is a good thing to point out again, though, just as you're going through, that if you can orient yourself one way, right, right-sided, you can look and see and recognize the structures are flipped. So again, with our right AV valve, the tricuspid, right, usually that's the first one we encounter. It just looks backwards because it is. Again, Rachel, what we kind of have here is in reference to the heart we drew. You can really see what are the heartstrings called? The chordae tendineae pulling these valves, right? So again, the AV line is about right here, right? If we were to quarter the heart that way. All right, good, you guys. Yeah, got real big. And then this was just the tidbit on when we do not have valve action working appropriately. The valve should snap shut, right? The chordae tendineae are actually little pieces of elastic. They're fibrous, elastic connective tissue. So they do generally snap closed. In general, when you get into nursing 1, so it's not likely, it's possible, maybe. It's possible that we'll be able to have a patient who has a murmur that you can actually appreciate. Do you remember anything I said yesterday about murmurs and how we grade them?
Or you can.
Yeah, so sometimes you can see grade 4s and 5s without even having to asphalt. But we do measure in grades. So grade 1 is you can barely hear it, not really a pathologic problem. 5 though, again, you hear that whooshing, you can feel it, you can see it, and that is, very clinically not good. But that's something you guys will get a lot more exposure to, how you grade, and that kind of thing in nursing, in the nursing class. Did you have something?
It reminds me of ultrasounds because when they do the heartbeats,
Mhm.
it sounds like a whoosh.
Yep, it does. So the Doppler with blood pressure, that we kind of talked about the Doppler a little bit yesterday, it sounds whooshy. But again, we're not ausculting the heart at that point. What are we truly ausculting when we use the Doppler? An artery, a pulse, exactly. I'm gonna skip through this stuff. You'll learn heart rate. One thing I would say though, what is kind of the general rule? We did talk about this a little bit yesterday. In terms of heart rate, you guys will be memorizing every species under the sun in terms of their normal vital signs.
80 is the magic number.
Okay, so that is with blood pressure. That's good though, guys, that's good. I'm glad you're pulling something. So what is the general rule with a small dog heart rate and a giant dog heart rate?
Larger or slower, smaller or faster.
Okay, very good. So the small dog has a higher, faster heart rate. The big dog has a slower heart rate.
Kind of like we were talking about that earlier.
Exactly. And the horses have an even slower heart rate than a Great Dane.
Hummingbirds are like
Yeah, exactly.
Buggers.
You're not counting that. Again, he's flying, he's alive.
I'm not surprised. They move so fast.
Yeah. So again, your picture of the arteries and veins. I would remember also just with this illustration, well, I'll ask you guys, what's the other thing that's important to know off of this?
That they have the valve.
Veins have the valves. Very, very good. And valves suck. They get in your way. You can't push past them sometimes. It just is one of those things. But very, very good, you guys. Again, with the arteries, they carry our blood away, our fresh blood away from the heart, right? Except for in the case of our pulmonary circulation, in which it is carried blood away from the heart, but it's unfresh blood. It's deoxygenated blood. And then again, he is going to actually carry all the fresh blood throughout the entire body. That, you already know the aorta is the largest artery, and he is quite elastic, and that allows for that fluctuation of blood pressure. In an event like a fight or flight situation, and my heart rate increases, all sorts of different things happen. One of the things that can happen within the body, because the aorta is so elastic, is when he's really needing to push out all that extra blood that the heart is pumping, he can stretch open a little bit. His hose can get a little bit wider, which means he can push more through to all of our organs that are going to try to die on us, right? And then you'll remember your arterioles, the little guys. Remember your capillaries, how thick are they?
One cell.
Very tiny little guys, very tiny, but again, making up the majority of what we consider our cardiovascular system, or at least the vascular portion. All right, and then our veins, I think we talked about all of this. Remember our trick question from yesterday, similar to the arteries. With our rule of veins, veins always carry blood back to the heart, and generally it's bad blood, right? Except again, in the case of pulmonary circulation, the pulmonary vein is bringing fresh blood from the lungs back into the heart. Otherwise, he is draining all the bad blood from everywhere all over your body into your vena cava so it can enter the heart, right? Yes, with the valves, the whole point of it again to help make sure it's a one-way flow. And that again helps with that buildup of pressure. Clinically, do you guys remember what we said about the vena cava yesterday? So yeah, it's the largest vein. Yes, it's the first step with cardiac pathway. But clinically speaking, so something we would do in a clinic to someone's vena cava.
The
Venipuncture on pigs.
It is venipuncture site in pigs. and guinea pigs. And you guys haven't learned this yet, but when you do venipuncture, generally you're coming in like this, right? To draw the blood, you're coming in pretty parallel. When you do the vena cava, because it is deep, you are straight up stabbing. So it's like this. It doesn't hurt. They're fine.
That's you.
You said pigs and what else?
Guinea pigs. Pigs and guinea pigs.
Two kinds.
Very good though.
Is it just because they don't have good like peripheral veins?
Exactly. Yep. Restraint is difficult for them also, especially guinea pigs. But yeah, pigs in general are really freaking hard to work with. Just
There's a lot between you and them.
That's true.
And they move pretty quick, surprisingly.
Don't you love guinea pigs?
I love guinea pigs. I do. Yeah, I do love guinea pigs. They're one of my favorite animals. I mean, I don't want to say it, but like I'm getting excited for the coulee. I am. I've been watching a lot of travel shows and it looks good. It looks good after a hard day's work. I'll be sure and take photos for you guys. So blood vessels again, the vessels break down into arteries and veins. I think sometimes people get confused and think that it's correct to say that veins are vessels, but it's not correct to say vessels are just veins, if that makes sense. Okay, so you can't really use that term completely interchangeably, and sometimes people do. So like, for example, because we've taken the exam now, we can kind of say that there's a lot of things where you have to list things out, right? I asked you, like, what are the 3 muscles? What are the 3 whatevers? So if I were to ask something like, what are the 2 main veins in the body, or 2 main vessels in the body, and you put arteries and vessels, that'd be wrong, right? Okay, just making sure to clear that up for the next time. So I think we've covered all of this. Again, with the vena cava being our starting point, this is where we start walking through the heart. Why don't we try together here? And if you say one step, you don't get to say another step. But let's go ahead and try to walk through, starting at the deoxygenated blood that is carried into the heart through the vena cava. What room do I enter now?
Right atrium.
The right atrium, very good. What doorway do I go through now? The tricuspid, the tricuspid. And now I'm in what room?
The right ventricle.
Very good, I'm in the right ventricle. Where am I gonna go from here? I need to get to the lungs, right? So what am I gonna go through?
Pulmonary
The
vein.
pulmonary valve, and I'm in the lungs. Woohoo, party time, gas exchange up in here. Now I need to get back to the heart. What do I do?
The semi, no.
Pulmonary vein.
Yep, I'm gonna go through the pulmonary vein because I'm going back to the heart. Now what room am I in?
The left atrium.
The left atrium, very good. Now I need to go through a doorway.
Is that the semi?
That's our bicuspid or mitral. And now I'm in
The left ventricle.
the left ventricle, and I need to get all the way to the pinky toe in this person's body. So I'm gonna go through what?
The frontal.
The aortic valve. So I don't know if this will help. Let's note it here. And I have it under on board stuff, but if you didn't note it, what we call the semilunar are the pulmonary. Whoa.
I get that
Jeez.
confused.
It's okay, that's why we're gonna write it out. The pulmonary valve and the aortic valve. Again, they call it semilunar because of this shape, because it kind of looks like that crescent moon. Okay, so if that helps to think, what are the 2 semilunar valves? Because that's how they're gonna break it down, is they're gonna call it AV valves, which we know again are those. And if they ask what are the semilunar valves of the heart, we would say this, okay? And this is technically right and left sided also.
So you wouldn't say like the pulmonary semilunar valve, or would you just,
Just
say
say pulmonary.
valve?
Yeah,
Okay.
just say pulmonary. Yeah. But it's just, again, a way to reference it. So it is important that you know in case you see that in the future in here or, you know, on the Whitney. Were you gonna say something? What?
That's just a lot.
It's extra, I know. But again, it's a different way to maybe break it down. It's no new information. It's just a different way to categorize it.
So,
By the way, you guys did that walkthrough pretty well. You did that walkthrough pretty well. I'm that person who thinks, step by step by step. So if that helps you, visualizing walking through a house.
It helps that you also drew the part like that, to where you
Like
break
this?
down. Yeah,
Yeah,
how you
I
break
agree.
down like the
Sure.
right atrium, the right ventricle.
Yeah. I mean, that is not completely accurate at all.
It's easy to picture.
But it works.
Yeah.
It works. It's not anatomically accurate. That'd be really hard to draw. But we'll come up with some more pictures too. Yeah, Sam.
so the last step is through the aortic valve.
Yep,
correct?
very
And then it goes out of the aortic arteries.
Exactly.
Ascending and descending.
Yep. We don't need to go any farther than that though.
Okay.
Okay. For this purpose. Now, when we get to blood, maybe we'll come back and talk a little bit more kind of the travel path, but we really don't need to go further than that in terms of what is the pathway through the heart. I just like to start with the vena cava because that gets us into the heart, right? You can start, if you want, just start with the right atrium. I really don't care. I just like remembering that the vena cava is my biggest vein, and it just makes sense if we start with a vein and we leave with an artery. That's again pulling those rules together, that veins bring blood back to the heart, arteries take blood away from the heart. Okay? I know, it's a lot. You guys are doing it. You are doing it. And then the fetal circulation. Again, just remember the basics. I'm not going to ask any major specific questions about this. It's probably a little bit more than we need to. Though I will ask what you do remember from this portion of lecture from yesterday. I know I'm saying like it's not important, we don't need to talk about it, but there was one thing that I kind of did mention, like it's normal to hear a murmur in the 9.5-year-old.
They have heart holes.
But
If they have heart holes, exactly.
And
You'll
those
hear
are-
a murmur because blood flow is getting through the doorways and it's making that sound. So with the ductus arteriosus, this is one we see a lot more of. Yes, you can see the open or patent foramen ovale.
Is that the formal name for the heart holes?
So formally, it's called a patent ductus arteriosus. The word patent just means open.
Okay.
And we do reference it as PDA. So if you want to write that down, PDA stands for patent ductus arteriosus. And this is, again, very common. I've seen a fair handful, for sure. And again, very expensive. How do we treat it?
Surgery.
Surgery. You're putting a patient with a very serious heart condition under anesthesia for a pretty freaking dramatic surgery.
Wait, so what's that machine called that has all the holes? The one, remember you put the big dog and he
Oh,
can
the
move the
echo.
holes so he can,
Oh, that's an echocardiogram, and that is just a table with holes in it.
I didn't know if it had a name similar to that.
No, maybe
Holy table.
echocardiographic patient exam table. But I think Dr. Vitale honestly cut the holes in himself. So the one thing I would say, guys, about this, or what I kind of mentioned yesterday, is if you have that pup, that little bitty pup coming in, and you escort him because you're getting ready to give him his carbo shot or whatever, and you can hear a whooshing, that is not normal, right? That is not normal. Now again, you guys, how many of you escultured or palpated last night? Were you successful? Were you successful? Define
Not
success.
sure. Well, like I pushed on it and I could somehow feel it, but like I feel like I was pushing here, but I feel like I felt it.
Then follow
It was
your,
like off.
yeah, so follow your hand down to where you think you were feeling it, because it's possible you were feeling it down here. Then just lead yourself, because again, your fingertips have the most tactility. Thumbs suck.
Yeah,
Don't touch anything with your thumb. Okay.
Because you'll feel yourself.
Well, I can remember.
Oh, that's right. I think I did hear
I
that
couldn't remember if
before.
I used my thumb or what, but it felt like where I was pushing, it felt like the pulse was actually down a little bit.
So try again.
It felt weird.
Yeah, try again. So did you escult or did you palpate?
I palpated all of my veins.
Cool, very
You
good.
let me.
Very
But I
good.
use like my whole hand just because
That's fine.
it helps
Sure.
expand like where it is.
Yeah, definitely. And then you can kind of laser point from there. So generally, I just use my fingertip, but sometimes on a difficult animal or one that maybe I'm having trouble finding, is I'll start at the stifle because that's nice and bony, and I can kind of like get my fingers used to the feel, and I'll just run it all the way up. And again, wherever I feel it, if it's in this finger, I just move my really good tactile finger over it. I was so surprised that Rose's calico, of all things, let her dig the balls. That was awesome.
Well, I think I felt her veins, and she's got some big veins.
Just never say that in lab, right?
Yeah.
Exactly. And I'm sure she does. I'm sure she does. And your little kid too, I'm sure.
I can
She's
like
being
feel my
difficult
wiener
for
dogs
me
hurt
when
right
I
just by
was
holding
trying.
it.
Yep. Yeah, you definitely can. You definitely can.
Oh,
Do you
my
have
big dog.
stethoscopes at home?
I do.
Take
Yeah.
a listen. Take a listen to them.
Hazel.
Guys, real quick, I wish I had a pair of stethoscopes on me to kind of show you, because I realized last night, and this happens all the time. In fact, I made this mistake plenty of times in my young vet tech life. But if you don't have the stethoscopes in right, you're not going to hear shit. Okay,
You can put them in wrong.
you can. So the ears point
Oh,
a certain way, and
you can tell because it hurts.
it does. It feels uncomfortable.
I didn't even know you could put them in wrong.
So they kind of are angled like this, and you want to have the angle towards your chin or facing forward. So if
Okay.
you have trouble using a stethoscope and you're like, whoa, 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 try flipping the earpieces, like flip it around, and then try. What I do, and it's just like muscle memory, force of habit. Whenever I have my stethoscopes on and I'm getting ready to listen to somebody, I know I have them in right, but I always tap my bell. And it's just a thing. But I mean, I tap it gently. So it's like, okay, I know for sure that, I'm going to get something when I put it up to this animals. Yeah, yeah. So we'll, like I said, we'll be getting into lab where you guys will be doing this kind of stuff and learning and feeling and all of that. But the more you do at home on your own animals, it's just really good practice too.
So-
Yeah.
We might have already went over it. I think it's on like the heart sounds one. So are there two different kinds of murmurs? Because there was like two different terms, and then it both said murmur.
So no, they're not two different murmurs. They're two different causes. So I'll go back to that.
Because when I was taking notes, it made me think, well,
So this was a question that Haley had asked yesterday. Well, what the hell causes the murmurs? Like, we know that it's a valve problem, but is it the valve itself? Is it the chordae tendineae? So that's where it's broken up here, Al, is valvular insufficiency just means the valves are not snapping closed all the way. So there's something wrong with the valves.
right.
This one is valvular stenosis, where the valves won't open all the way. So it's sitting there kind of flapping in the wind like a plastic bag, making out weird whooshy sound. So is there a way to diagnose this through auscultation? No, there's not. How would we diagnose which one of these we're dealing with here? An echo, where we can live watch, see it on the probe. Is the flap or the valve just flapping in the wind? Or can you see blood flow sneaking through because it didn't close all the way? Because that's what you see.
So those are two different causes, but there's more than one type of.
There's 5 different types, and they are based on severity. Stages, yeah.
That makes sense.
Yeah, so this is just what's behind it. What is the reason that the valve's got a problem right now?
Oh, okay.
And again, that's often more than I don't want to say care to go to the length to diagnose, but honestly, we know we have a problem. We know we need to fix it. We know we need to reduce the workload of the heart. That's going to be the primary care or primary treatment. Some people though they'll go get an echo. They will go to those further lengths to see, what's the real
I would
cause.
like to bring Emma one day.
Sure.
But, like, she just needs to remain very calm. She has a stage 4.
Yeah.
And you can feel it, and I listen to it all the time. But it would be like.
I mean,
good to
I would
listen
love
but
to have her come in for that, but I
don't
do
want her to
worry.
get worked up. Yeah.
There's just a lot of us
Mhm.
in what would be that lab.
She would get very
Um,
excited because she loves people.
I
I
want to see all of
know
us.
she would
Yeah.
get too overworked. I think.
That's something, we can see what we can do. I haven't in the past, But I was thinking the other night, there was a thing that I had when I was in vet tech school. It wasn't through my school, but it was through the clinic that I worked with. I would always come to work at night after classes and be like, this is what we learned today. And somebody somewhere would be like, oh, let me tell you all about it. And when I brought this up, they were like, oh, you can go online and find this website. I don't remember who it was, but we can do some digging. We can actually listen to these things. And I think they have similar ones for different rates and rhythms and that kind of thing. So we can see if we can find that and at least post it so that as you guys are learning, you can always go back and reference. I will say though, the absolute best way to practice with your own animals at home. You have the equipment, right? And if you're doing
So related to the heart, what is, I think we went over it yesterday. I think it's, have you heard of the article that the FDA put out about the grain-free diets and they cause, is it cardiomyopathy? Is that what it is?
Yeah, so I think it is dilated cardiomyopathy. What exactly is the underlying with that? I can't say without having some of that material in front of me. But it does have something to do with the way that the nutrients are used or lack of nutrients being used, and how it affects the heart muscle. So it's almost like the grains, again, like I'm freestyling here. This is not like research based. But what kind of happens is, again, the grains come in and kind of act like an antigen that says, holy shit, body, here I am, I'm gonna mess you up. And the heart says, oh my God, I need to get like crazy big to fight this off. We don't exactly know.
Oh, so that's where it gets big.
That's where it gets
Okay.
huge, like the x-ray that we saw yesterday. Yeah. Which takes me a little bit more research on that so I can give you a
Because we
better
have-
answer.
We have
But
two
we
so
don't
far.
know.
That, and then we always, when we ask what you're feeding and people say grain-free, then we show them
Yeah.
the article.
Mhm.
But yeah, it kind of intrigues me.
Yeah, it is interesting, and there is so much research happening right now. I mean, that is a relatively new finding, and there's still not enough information with what they first researched to really give a causative, like, this is exactly the physiological effect of what's happening when you feed it. We just know that it
No,
is
it's
linked.
Yeah.
We just know that it's linked. Yeah.
Very quick Google says that the site Easy Auscultation has over 100 different files you can listen to.
Sweet.
And what would be a good, like, what would you call a triple beat murmur? Because I hear that a lot. It's da-da-da, da-da-da, da-da-da.
like a
da-da-da.
galloping
thing.
It's
I
a
think
So,
triple
it's
beat.
just a-
I would probably say it's probably, I mean, again, without hearing it myself, we do have the normal sinus arrhythmia.
Yeah, it's
where
not
it-
quite a sinus arrhythmia.
Mhm.
It's not breathing linked,
Yeah,
like the sinus usually are.
Mhm.
We get those a lot too,
sure.
but it's a
When you
triple-
hear that, are you putting an EKG on?
No, we don't have those.
Do you have
We
anything?
just have pulse ox. that have-
So I mean, that would be the best way, is to ensure that it's not arrhythmia related. When you hear that, are they still going under?
Mhm.
Yeah. I mean, it is what it is.
Yeah.
Yeah, you know, if everything else outwardly is normal in terms of color, perfusion and whatnot, it probably is something just idiopathic or unique to that pet. Yeah, I can't say that I'd be able to say. My first go-to always when we have somebody, oh my God, Miss H, come listen to this. It's a weird something going on. It's a normal sinus arrhythmia.
Well, we hear those fairly
Sure,
often.
yeah.
We just get a huge population, but those ones, you know, they're very breathing linked. They speed up and slow down. And speed up and slow down.
right.
They still have the rhythm,
Yeah.
but this one is just like a triple beat. I don't know.
I'd be interested in keeping a log. Every time you do, write down breed and age,
Mhm.
and just see if you see a pattern.
Our vets just say to log it as
Mhm.
a sinus arrhythmia, but it's different than
Yeah.
like traditional.
Right. Yeah, I don't know. Ask Dr. B too.
Did you say the email or the website? For
Easy
the sounds.
auscultation.
I didn't hear it. Could you repeat that?
Easy auscultation.
I-
It was just a quick Google.
Yeah, thank you. That's awesome. That's great.
Easy.
Okay, so we talked about this a little bit too yesterday as far as the pulses and the auscultation. Doing them together during physical exam is what I prefer and the way that I'll teach you guys. Whether or not, you take that out into clinic and do it or not is up to you when you leave here. But we do want to make sure that we do not have a pulse deficit, or where, again, the heart is beating this way and the pulse I feel is totally different. We want to rule that out during our exam. Hey, Doc, what's up? We do have ACE.
Is it in the lockbox?
No, ma'am. It is in the drawer on the back wall where the other drugs are. It's the drawer under the surgical pack. It's probably far in the back. If not, for some reason, though, I think I just saw it there, whatever day that was we did the CAT, check the crash card.
It's not in the crash card.
Then it's in that drawer. Okay.
I think we'll need it, but just in case.
Who for?
Howie and Honey.
Oh,
I
okay.
don't think we need it. Just
Hey, ace them if you want to ace them.
like
I
to
ain't
know
got no
where it
problem.
is, just in case.
Yeah.
If
It should
Dog
be
was
right
here, she'd already.
Yeah. Cool. Thank you.
What is that stuff?
Ace promazine. It is a phenothiazine
Oh.
derivative.
It makes them mellow.
Sometimes. Sometimes. It is a sedative that we'll use sometimes on animals in labs like X-ray, where they're being manhandled a little bit more than standard. And I go back and forth. I do like ACE. I do like ACE. It doesn't always work the way you want it to. Sometimes it can backfire in your face and make everything worse. And you don't use it on animals under 4 to 6 months, depending on that. Tell you some stories. Okay, so again, everybody kind of tried sort of a little bit to feel these guys up. If not, try again, right? And then try again tomorrow too. This is going to be something that you want, like within 5 seconds of going up to an animal in a cage to be able to get a pulse. Okay, you cannot just sit there for 10 minutes dicking around trying to feel a pulse in clinic. That's not going to work. So the more practice that you have, again, with your pets at home who have a pulse, the better that you're going to be. The better you're going to be when you come to lab, and then when you get your first job, you'll just be a lot more quick and maybe a little bit more confident too.
So what's your recommendation on like how to hold like the
Why you do that.
stethoscope and then like
So
it's like if I had her at the clinic and was doing it on my downtime?
Yeah,
how do you
sure.
recommend
So
doing that?
honestly, what I would do is wait until she falls asleep and then I pray upon her body. Otherwise, what I would do is I probably, like, are you talking your kid that you brought the other day, that size dog? Okay. So what I probably do with her is like sit on the ground, have her like, come on girl, have her straddle my legs. I'd put one arm up under, I'd have my ears in, and I'd come up under with my other arm. So I'm kind of holding her like this, straddling me, right? But I'm hearing with this hand.
And then this hand would feel the pulse at the same time.
Well, no, that's a little bit trickier. It is a little bit trickier for you
Okay.
guys to feel the pulse and to sculpt at the same time. If you can do that at home, you're awesome. That's probably not going to be possible, but I'd
Okay.
like you to at least sculpt
Mm-hmm.
and feel the pulse, and then you'll be able to put those together when you get to lab.
Okay.
Because I doubt your kid's got a pulse deficit. I'm sure she's just fine. Because yeah, that's generally where I would have somebody hold the dog for me. I would bend down and feel, and I'm left-handed, so I do a crisscross a lot. But I'd feel and then have my stethoscope right here. So
Okay.
I'm not as tactile on my right hand as my left, so I do prefer to use my left hand for those kind of things. But remember I said before about being ambidextrous. In a giant dog with bounding pulses, I can feel no problem with this hand. But for a lot of you guys that are right-handed, you'll use your left hand for the stethoscope. Feel like this.
Okay.
And don't worry, we'll show you. We'll show you. Okay, so blood pressure. I think we pretty much talked about, the most blood pressure that we need to talk about. Yes, you guys remember your magic number is 80. What happens if it goes under 80?
It's
bad. It's bad. Haley, what is it specifically? Organs are starting to suffocate because they don't get blood, and they're going to start shutting down. And some of that function may not come back. Okay? So it is very important, again, during anesthesia to monitor blood pressure, but some conditions, disease conditions can cause low blood pressure. It's actually more common to see hypertension which is high blood pressure. It's really freaking common to see high blood pressure in cats. It's hard to treat high blood pressure in cats, especially clinically, because they come to the hospital and their blood pressure immediately increases 40. So we don't know what's the true blood pressure. So that's something that's a little bit tricky to manage sometimes. But generally, you know, we're putting them on some medication for that. Again, with the systolic and diastolic, you guys remember the mean, I think, is something that's more important than the diastolic, if you'll remember. And then the Doppler. The Doppler is the best. It's the best. And the other one is just the digital computer version, right?
So is the Doppler what like we use the thing and then it has the thing?
No, generally, you guys, when you go to the nurse, you have the oscillometric. So somebody wheels in a little machine to you, slaps the thing on and pushes a button. That's generally what we consider an oscillometric. The ones that you do on your patients, and I just don't know how far you've gotten to them. I'm sure you've seen a Doppler before, but you hear it
Does it look
without
like
a
an
stethoscope.
ultrasound machine?
It's like a little square speaker box. The one we have is actually new and nice, and it's about yay big. Kind of looks like a speaker box, but it's bright yellow. It has a Doppler probe that's about this big.
Okay.
That crystal is $3,000, and I'll kill you if you drop it. Same with the ultrasound machine, because it's the same crystals.
Right.
But the Doppler, it's a little square on a wire. You shave the animal on the paw, you put the Doppler on, you tape it into place, you push the button, and now you can hear it. Whoosh, whoosh, whoosh,
Every time
whoosh,
we hear Doppler, I
whoosh.
think of the what's it called? The weatherman. Yeah, the meteorologist. I think of like on
Oh,
like
sure,
on
yeah,
the
not Doppler.
Doppler radar or something.
It's practically the same idea though as an ultrasound though, right? You just aren't looking at a screen.
It
you
is,
hear
exactly.
It's
It's
sound
exactly it. Yep, exactly. You're using the sound waves.
I just think of the old school cups that have the little and
That's
then
Mm-hmm. So that's just one portion of the piece. Because if you don't have the machine, let's just say you have a cuff and a human. The human has a stethoscope. That's how they're listening. We don't quite do it that way. It's a little bit different. Similar concept, just a little bit different. Yeah, so old school speaker box from ET. Those are super ghetto and old. Though they work. That's how I was brought up on, was those old school guys. The one we have is a little bit more modern, but it works exactly the same.
Do they have a screen?
It does not have a screen. Nope, this just has a speaker. Because again, we're not looking, we're listening with our stethoscope. It's just coming out of a speaker. And again, I love it for any procedure that I do because it gives that reassurance that my patient is alive. I mean, really, that is what it is. Now I'm going to be monitoring that patient across other different, measures, but at least I know at all times, as long as I'm hearing something, my patient is
So
alive.
would that be the same as like the heart rate line and under?
No, no,
That's more
ma'am.
EKG.
That's in the same ballpark.
Because then you can still hear if they're alive.
Mm-hmm. So the EKG we will have on. What I look at on the EKG is not representing the pressure of my blood,
Gotcha. Okay.
but it is representing the electrical conduction and showing if I have an arrhythmia or something weird going on. So,
Right.
yeah, having visual, audio,
So this would be in, as
hands-on.
well as EKG?
in ideal world, yes.
Okay.
Yeah. So with that bad cat shave job, we did not put an EKG on him, even though it would have been appropriate. Why? Because we were shaving his ass. We would have to sit there and mess around every 5 seconds, and we'd have no EKG to really look at. So it was more important for us in his situation, where again, he's 9.5 years old, bad cat, needs drugs that are going to make him go bradycardic, that he definitely has to have blood pressure on.
Gotcha. That makes sense.
That one's super fancy. Ours is not quite that fancy, but that's really
Is
nice.
it tiny like that?
It is, yeah. I'm not joking you. That's why I said I'll punch you in the face.
Oh.
I was gonna kill you.
I was gonna say it's
Now you're downgrading.
I'd rather be punched.
No, guys, and that's something, okay, just real quick as we wrap this up, you know, I make jokes like that all the time, guys. It's really your money. I mean, and people before you, you know, that spent that. But the reason I want you to kind of start thinking this way is if you start a job in clinic and you drop their Doppler,
You were last on the line for anything.
you're last on the line if not getting fired over it. I mean, so honestly, guys, the girls that did the cat shave job, they were hating on me because I am a really big picker with all of my equipment. And it is because I know the price tag of every single thing and I know how long I have until I'm allowed to replace said piece of equipment. So clippers do not go on the tables. Clippers belong on the ground at all times. And that's because those clippers are very expensive. And what happens when Gabby walks by and she kicks the cord and the clippers break on the ground, now I can't shave for surgery. Now I have to put in a PO to accounting that's gonna take a week and a half, and that just messes everything up. So again, you know, really being mindful of everything you touch, interact with, use, and that's here in school, but also in the real world. Because yeah, you're not gonna get that raise if you broke the refractometer or if you dropped the microscope. I mean, it's just stuff like that, I mean, they wouldn't be wrong. Yeah, to let you go or to ask you to recoup the cost or yeah, definitely not get a raise, that kind of thing. So I'm not trying to like really be mean about it like that, but just put it in your mind that that's the way you really need to be thinking.
It's the same way you keep getting bit.
Yeah, that's a good point too. That's a good point too. I don't know. Yeah, I mean, it does. It adds up. It costs. Okay, so I'm going to just fast forward just a little bit to the very last little tidbit here. So we just left off yesterday with venipuncture. So, I feel a sneeze coming on, you guys. Thank you. I am. Yeah.
Last night I couldn't sneeze.
Oh my gosh. So venipuncture, this kind of just shows to you some of the sites that we use on different species. So in the cat and the dog, the jugular vein, best choice, just because it's the biggest, easy to access, but it can be difficult to learn, okay? And then we have our saphenous and cephalic vein. So the cephalic, do you remember what this word means? Towards the head, right? Cephalic or pertaining to the head. So it makes sense that the cephalic vein, the one that is
Runs to
the head, is one of the ones that we use. And then we have here in the dog and the cat, we have the saphenous. The dog, we do the lateral saphenous. And in the cat, they kind of have it, the femoral vein. Really what we call that is the saphenous, the medial saphenous. Generally, it's not the femoral vein. And then in the horse and cow, the jug is the big one. In the cow, the second other site that we can use with some to little resistance is the tail vein or the coccygeal vein. So this is something you guys will do when you get to large animal. You'll do blood draws on both of those sites and then on the horse as well. The horse is stupid easy. Cows, pretty stupid easy. Cats, probably gonna be your hardest. And then dogs, maybe their jug. People struggle with jugs until they meet me. I got you. Because it's not hard. It's not hard, but it is important to know your anatomy. You know, this isn't a great representation of where the veins are, but just real quick, I always tell everybody when they're looking at the dog and they're like, I can't even feel the vein. What I'll tell them is, you know where it is. You take your chin and you take your jaw, the fattest part of your jaw, right? At your mandible. It lies directly between these 2 points, okay? In a dog or cat or so if you have those 2 locations and you know that your trachea is midline, don't poke that. Go lateral, go lateral. It's not gonna go past the jaw, okay? So using your anatomy as a landmark to say, okay, I know it's gotta be somewhere in here, just poke it. Chances are you're gonna be really freaking close and you're gonna get it, okay? The other thing I think that people don't do correctly is occlude properly. So before you can draw blood, somebody has to hold off. I will always say, and I think I heard Dr. Puckoff tell you guys this at one point too, that if you can't draw blood, it's the restrainer's fault. That's true. It is true. And don't take offense to it now when it happens to you and your buddies and you can't get blood and it's Allie's fault. But it is harder to restrain than it is to draw blood. Remember that. Drawing blood is stupid easy. Restraining the animal perfectly and occluding appropriately is difficult. I've worked with people before who, I mean, they get the biggest attitude when I say, please re-roll. Okay, don't get an attitude. I'm just trying to get the job done here, and your job is harder than mine, right?
What does that mean?
So when you occlude a vein, you generally are rolling it to a
I've only
certain
been on a
extent,
horse, so I know.
and
I
it
was
is
like, yeah.
different on the horse. Yeah, it is different on the horse. You know, I do teach a very specific way with dogs and cats where I expect your hand to be behind the elbow. There's a reason for that. So the dog's arm can't pull back. Because again, whose fault is it when I can't draw blood? The restrainers. So, and you know, that's kind of a joke, but it's kind of true. It's kind of true. With the jugular vein though, you are holding off for yourself. And this is where I think people struggle, is they generally are relying for somebody else to hold off for them. But when you're doing the jug, you hold off for yourself. So what it makes difficult sometimes is you're holding off and you're drawing with the other hand, and your hands might overlap, or you need to get under yourself or whatever. I'll teach you some ways to make sure that doesn't happen. And then again, being able to use both hands to draw blood is very important as well. Okay, so yeah, obviously we need to get into veins to draw samples, give drugs IV, place catheters, all of that kind of stuff. So knowing your veins is pretty important. I would make sure that you at least have a decent handle on this. There's not many. Everybody has a jug. Arm veins are called, and leg veins, saphenous. So in dogs we use outer, in cats we use inner. Okay, so medial in cats, lateral in dogs. Pretty easy, right? Cool.
Fat cats are the worst.
What's that?
Fat cats are the worst.
Fat cats are the worst. That's where you use your anatomy. You know where it's supposed to be. I haven't shown you guys, I don't think. Did I show you my little cheat sheet book? I'll grab it for intro and I'll show you because, dude. Okay, so real quick, just super quick, and then I'll let you guys go on break. So dachshunds, God bless them, they suck. Bassets, God bless them,
I'm glad
they suck.
somebody else
And it's
knows
because their
that.
arms are like this, right? So you're working with T-Rex vein.
And they don't want to give it to you. They want to.
They don't. So that's where you place the catheter down here in their metacarpals or metatarsals. It can be a little bit more painful to place, so you can use some lidocaine gel. But they have these arms, so you can't place a catheter up here because it's going to be stupid. Place it down here. And that's what I had a schematic for, because I had a freaking run of Bassets this one week. And I was like, I can't remember where their accessory vein is. Print me out a freaking picture, put it in my notebook, set that picture right beside the dog paw I'm working on, place a catheter, move on with my day. Right?
I'm sure it's easier than a dachshund though. Dachshund paws are smaller than Bassets.
They are, yeah. So dachshunds, I mean, you're going to the knuckles. I mean, you're going as distal as you can to get that catheter in. Ear veins, we haven't even talked about. Dachshund ear catheters, Basset ear catheters. They've got a great vein, better than this one.
Can't you place like a central line?
You can, yeah, you can definitely, or just a plain old over the needle catheter in the jugular vein. That's just a cheap, lazy, easy way to do it. So yes, you can. It kind of just depends on what the patient's in for. Yeah. Okay, guys, why don't you go ahead and take your break? I'll let you have. Seth, how long did you get?
10 minutes.
Okay.
Until 05.
Okay, well, why don't you guys take 10 minutes? Be in the hub at 10 after, okay? Thanks.
Do I need anything?
Good job, you guys. Good review.
They said we need a pencil. While we're there, I'm gonna get some worksheets for the other classes.
Oh, great. Okay, cool. Thank you.
And
The
the
planned graduation date is just 21. That's fine. And then
yeah, I literally
Have
went to
you
Walmart at 10 o'clock
joined
last night
SNAP
and,
yet?
like got all this. I'm like, I need better organization.
Okay, cool. I'll send
It's
that
like I
in.
have
And this is,
skeletal.
so that you
and
guys can
muscular.
sign up for, or try to apply for the, scholarship they have.
So how do you get like the same thing?
So, what you wanna try to do with either your dog or cat is to go all the way up the inner thigh to about the point where you're leaving the body and heel. And like I said, it can be easy, if your animal's big and has really good blood pressure. But I mean, again, Rose and her cat, she was able to get it, so that's pretty good.
2 cats and a pit bull. And my pit bull is pretty good.
Yeah, try for sure.
Like he looks like he manscapes. It's funny.
Oh no,
The inside of his legs look like chaps.
oh, poor thing. Funny. Hey, I'm recording
Oh, is it going well?
so far, but I was in class from 10 to 12:30, and when I left the classroom, it was still like uploading because it was a 2.5-hour video.
Yeah.
So by the time Dr. P started class, I didn't have a chance to go back in and like retrieve it. So I think it's still saved on the computer.
Okay.
But like I tried doing this PC on this one and it's not pulling it up. So I'm thinking it's just on that computer, like
Yeah.
not on my user.
Yeah, it'll.
So then I'll just have to remember to come back and do the same thing in each room because I'm in 2 rooms today. So that I think, I don't know how fast they're wanting me to try to do this, but they're gonna have to come help me if that's the case.
Yeah, if we can find some other software where it doesn't, I don't know why it does. It's like it splits up into 2 different files and it has to.
Well, and I haven't checked, but like when I came back like 20 minutes after I ended class, it was only at like 7% uploaded. So I was like, I'm gonna go ahead and do
It's
something else.
ridiculous. We'll definitely look into it and see if we can find some other software.
Well, this afternoon when I get done here, I'm gonna sneak into that other classroom if Dr. Miller's done and try to open it. And then I'll try to email that one out to the hub or to whoever and just see if it works. But I'm kind of afraid now, honestly, when I try to send somebody a PowerPoint, it won't let me because of the size of the file. So I'm like, is it gonna be an issue with the size of this file to email it to the hub?
Yeah, but
I mean, it's.
would probably have to.
I mean, I love the idea of doing this and it's working, but again, just so much data.
I would say what we could do. My first thing would be like if we could upload it to SharePoint online and then just send them a link
Right?
where they can download it.
I mean, I'd be okay with that.
And yeah, like I can show you our online SharePoint how we can do that.
Okay.
We can set up time. We can go through all the things.
Well, I can hit you up Friday, maybe.
Yeah, for sure. Any day's fine.
Well, at least I'm recording. There's that. First step. Do you know anything about the NEPRIS?
I do not.
I don't know if I'm even saying it right.
Remember.
It's something about recording ourselves and using some service to share. Like if somebody wanted to use my lecture at their school, they could. But there was something about their software and their videos, and I'm like, oh hell no, like that ain't gonna fly. So Lynn's supposed to send us more information about it. I told her I'd be interested because, you know, I kind of already do that kind of stuff. I just have to pay for it.
Yeah, that'd be something we could look into.
Right? Yeah, I forgot my sticky note, so I had to go get that today.
Oh. See, Jen.
I was close, but
Sweet. Well, yeah, we'll just set up a date.
well, and I'll let you know how it goes when I pull that one this afternoon, and or if I can just put it on a USB drive, and walk it up there. But I'm like, that's a lot. That's a lot for
Yeah,
somebody to do, transcripting. Like, that's gonna be a full-time job, just sitting there for 2.5 hours of transcripting.
Is it gonna be some of your guys? Like
In the
Bristol?
hub.
Oh, in the
Yeah.
hub.
I know,
Oh, man.
their idea, not mine.
Just some, like the core recording.
Do that on the side while they're.
Well, and I mean, I'd like to eventually get these up on Blackboard too, but again, I'm kind of worried about how much
Space.
space it's gonna take. Because if I were to record every single one of my lectures.
Yeah.
Just in anatomy, it's a lot.
Yeah, that'd be a ton. But, yeah, like I said, we can look into that on that, sure. We don't host that Microsoft does, so
Oh, nice, yeah,
we could,
it wouldn't matter.
yeah.
Yeah, there you go.
But, and then if we could just embed those videos. in
Sure,
on the board, so we can sort out all the permissions.
Right.
But yeah, just like, hit me up. And we can.
Yeah, I'll let you know how it goes. I could talk.
Okay.
Cool, dude, thank you.
Yeah, sweet.
Appreciate it, man. All right, well, I think I'm waiting on maybe two more people. So we'll just give them a minute before we get started here. Did you guys enjoy your review? Did you feel like it helped? Kind of roadmap it, maybe? Yeah. Good. So we're just gonna review a little bit more of the heart and finish up with this. So we're all ready for tomorrow.
Which chapter is this starting on?
What's that?
Which chapter is this starting on?
This is chapter 14, the heart. Yeah, 14. All right, you guys, so just as kind of a review, we're gonna hit a couple of these slides, some of the ones that had a little bit more meat to them, just to kind of, again, review and then wrap up the cardiac conduction system. So again, if you haven't read chapter 14 and you don't by, I don't know, some point today or close to today, we're done with it, right? We're done with the heart, we're moving on. So again, it's really important to make sure you're reading your chapters and getting ahead, even for a lot of your body systems, because there's a lot. There's a lot to the rest of these body systems that we're going to start learning about. We kind of break in easy with skin and bones. Do you agree? Right? We kind of jumped off the deep end here. Okay. So we're going to review a little bit, and this is just starting us out with the cardiac conduction system. So you guys had your 4 steps down that we had on board steps, so that's great. Just again, as a kind of a picture, with how the sinoatrial node starts us off. What I really want to make sure you guys have down pat in terms of memory is where is the SA node? What room of the heart? The right atrium. Very good. Very good. So you know that the SA node is a pacemaker. You know that he's step 1 in the conduction system, but you do have to know that he lives in the right atrium. That's exactly right. And then you can see, of course, he is going to start off the heartbeats, right, throughout all of the chambers of the heart, but specifically carrying from the SA to the AB, again, the AB being the wall that separates the atria from the ventricles down below, following the bundle of his down both sides of the heart and up around each ventricle. And again, this helps for maintaining the heartbeat, but making sure that every chamber of the heart contracts and relaxes. Again, that's not all happening at exactly the same time, but this conduction system, again, allows for that heartbeat to be maintained. You'll remember your words from yesterday's systole and diastole. The systole being where we see the heart working, he's contracting, and then we have diastole as the relaxation stage of the heartbeat. And do you guys remember what we said flatline is? That's exactly what it is. Did I just say it? I didn't just say it. What's the medical term? No, flatline isn't it. It's kind of close to systole, but it's asystole. A, the prefix meaning without, right? You guys want to have that stuff down. We've covered A and an a lot, right? So you should be able to throw that into any term. So asystole is our flat line. Do you guys remember what other system we kind of talked about with these terms? And it's the cardiac conduction or cardiovascular system, but what other piece of it did we reference this? So it's a test we do. Good guess, not EKG though. Blood pressure. Blood pressure. We say systolic, diastolic, and it means the same thing. So when you get your blood pressure taken at your doctor's office and they give you 120/80, that's systolic over diastolic, right? Okay. So it makes sense that we use the same terms as blood pressure. The pressure of our vessels does kind of go hand in hand with how hard the heart is contracting and relaxing. Okay, and this is what we started with for board stuff today. We want to remember again, our love is the first sound, and this is the AB valves closing, okay? Somebody had worried earlier that her notes were wrong because she wrote mitral from yesterday's notes. If you remember that the AB valves, right, are your bi and my on the left side. But if you want to put in your notes, the love sound is the closing of the AB valves, which we know are the tricuspid, bicuspid, aka mitral valve. We wrote this out also because we were getting a little confused, I think. People were saying the semilunar valves. That's not wrong, but we want to make sure we know that the semilunar valves are the pulmonary and the aortic valve. Okay. Calling them the semilunar valves, again, isn't wrong, but it's not clear enough. Okay? It's just not clear enough of where are we going, what are we going through. Oh, that picture is one of the backwards one, isn't it? We'll find one of the other ones. Why don't we, one by one, walk me through the steps of the heart. Do not use your notes that you just did your little worksheet on, because you just did that, so it should be light up in your memory, right? Okay, we're gonna do one person at a time. If you wanna raise your hand, fine. If you answer one step, you can't answer another one. Okay, so I'm in the vena cava. I'm bad blood, and I need to get into the heart. What room do I start out with? Mercy.
The right
Okay, sweet. So I'm in the right atrium. I need to walk through this door. What door is it? The tricuspid. Very good. Now what room am I in? The right ventricle. Very good. Now I need to get to the lungs, but the lungs are clear out there. How do I get there?
Pulmonary.
The valve, that's the doorway, right? So the pulmonary valve, yes, I'm gonna have my pulmonary artery lead me to my lungs. I have gas exchange take place, right? Now I need to get back into the heart. So yes, I'm gonna use my pulmonary vein to get back into the heart. What room do I enter? The left atrium. Now I need to get through this next door. What is it? The bicuspid or mitral. I'll take either one. Now I'm in what chamber? The left ventricle. And I need to get into the body, all the way down to your pinky toe. Where do I go now? The aortic valve. Very good. Very good. And we drew this out a little earlier to kind of show again the AV valves. You have one on each side separating the atria from the ventricles. Again, this is not anatomically perfectly correct. It's just a nice schematic for us to use. So our AV valves, right? And then we have our aortic leading to the body, and we have our pulmonary that's leading to our lungs. This also kind of references that lub-dub sound, right? Lub are these, dub are these, right? Cool. And you guys, that's exactly it. You walked us through the heart. Do you feel comfortable with that? So, guys, you know, I've said it before, it becomes even more important with these harder, and they're going to get harder, body systems. You have to figure out a way to remember it, right? So I like walking myself through the heart like a house, right? And thinking of it, what room am I in? What door do I open? Where do I need to go on the other side? Okay? If you can't remember or you don't have another way, steal mine. That's why I use them in class, is to hopefully give you an idea of what you can do to remember it. Okay? Okay. So that was good. You guys did exactly the path. Exactly the right path. And then we have the weird sounds that are not normal. So you remember we talked about murmurs a little bit yesterday. We have two different reasons why murmurs happen, and it has to do with the valves, right? So valvular insufficiency is the door is not closing all the way. For some reason, the valve is not closing all the way. Blood flow is escaping and making that sound, that whoosh, right? Or we have valvular stenosis, where the valves don't open all the way. And generally with valvular stenosis, we kind of see this flapping in the wind of the valve. It's like a plastic bag in the wind, making noise. How do we know which one it is? Can I auscultate and tell what type or what cause of the murmur? Well, that's what I'm going to hear when I auscultate, but is it going to tell me which one of these the dog has? No. No. You would hear the whooshing from both. So tell me then, how would you diagnose, or how would a veterinarian diagnose what valve problem we're dealing with here? Exactly, using the echo. Remember where we can see in real life what's happening? So we can either see blood flow squeaking out because the door didn't close all the way, or we can see the flapping valve, right? So that's exactly it, exactly it. You ausculting and hearing the whoosh, 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 whoosh of the murmur pretty much just tells you you've got a valve problem. Which one it is, we don't know. Sometimes we don't care. Sometimes we just put them on the drugs and move on with our day. But there will be times where we do need to determine, or we want to determine, what is the exact cause. But yeah, they're both going to cause murmurs. They're both going to sound the same. Okay. One other thing, because again, you guys will talk murmurs so much more when you guys get to nursing. Excuse me. one of the things we talked about a little bit yesterday with murmurs was related to age. Does anybody remember kind of where we went with that yesterday?
I'm gonna say it was weird. Sorry.
Go ahead.
Didn't you say it was weird to have like a healthy adult with a murmur, but it wasn't weird for like an older adult to have a murmur because they're just.
You're close. You're very close, girlfriend.
Okay.
So the old ass dog with a murmur, it makes sense. Makes sense. An adult with a murmur probably got something going on. This age, though, are puppies. Yeah, and I think I said 3 month yesterday. But if you have that 3-month-old puppy coming in for his December parvo and you're getting his vital signs and you escort and you hear a whoosh and he has a murmur, there is something wrong. Most likely, what is it? A birth defect.
Something doesn't close.
Exactly. So if you'll remember, we talked yesterday about when the baby is born, they take their first breath, it signals to the heart to close the holes that were open for fetal circulation. And the big one that we see is the ductus arteriosus that stays open. And this is something, again, very common. I've seen more than a handful in my career. And it sucks. It sucks. But it is a birth defect. Something didn't close right when they were born. And it is this ductus arteriosus. I did have the other group note in their notes if they didn't already yesterday. PDA stands for patent ductus arteriosus. Patent means open. You will hear that word a lot in medicine. But a PDA is a patent ductus arteriosus, and it usually is in a very young pup. Guys, I can't say I've ever seen a cat with this. I'm sure it does happen, but it's really common. Again, full breed dogs, sadly. And then again, we usually catch it at their first, maybe second vet visit, right? That's why I'm a stickler for, I don't care who you are or why you're coming. I don't care if you're just getting a dewormer, you should be listened to and examined by someone, right? So yeah, that was kind of another point I wanted to make with the murmurs, because if you have that open, hole, not technically in the heart, but in the circulatory system, what is that? It's a leak. The leak is what we hear as the whoosh. Just like back with the valve issues, that's a leak too. And that's what we're hearing. Somebody in the other group had Googled a website that was called like freeauscultation.com, something like that. So you guys can maybe try to hear if you're interested in hearing murmurs, because here's the thing, most likely we're not going to have a patient that has a murmur that comes to clinic, right? Yes. We can talk later. We can talk later for sure. Haley had offered hers also, but not for 24 students to listen. That's way too much, especially for a dog who has, you know, heart condition. So we can talk. How many of you guys assaulted someone last night? Not assaulted, but assaulted. Okay, cool. Were you successful? Okay. Okay.
I felt my cat's femoral artery.
Good, good. Yeah, and Rose, I'm surprised your cat let you, little calico baby. How many of you guys palpated? Everybody palpate? Just you guys? Okay. So this is something that, you know, I am going to be a stickler on. I know we haven't really learned it in school, but again, the concept's not hard, right? You feel up the leg until you get to the inguinal area, and you should by then at some point in the medial thigh feel a pulse. It's not hard. You guys should be able to go home and do this. And if you're having difficulties today or yesterday, try again today, right? And then try again tomorrow. And then maybe try counting it, right? See if you can actually get a count. But the thing is, you do need to be practicing just these really super, super basic things like listening on a stethoscope and palpating with your pets at home. One of the reasons why, guys, really when we start doing our labs, and even more so in clinic, it will not be okay for you to take 10 minutes to get a heart rate on someone. That's not going to be okay. So you want to be able to really practice on, again, the patients you have at home, because they have pulses and heartbeats, right? You're going to try to practice this kind of stuff so that when we get to labs and really, you know, learn this stuff together, you feel a little bit more confident, right? In doing this kind of stuff. And then, like I said, in clinic, if you were to take 10 minutes getting a TPR or pulse, they're probably not going to hire you. Or they're probably going to find somebody who's faster. Just saying. Because this is like really basic. One thing I did share though with the first group, because I know some of you guys have never used a pair of stethoscopes before ever, there is a right and wrong way to put them in your ears. Okay, so if you're having trouble with your stethoscope or don't think that you're hearing the right way, I'd be more than happy to show you. Okay, at least before we start having our labs. But I do want you guys to be practicing this, even when we're done next week and we jump into GI, and I'm asking you to palpate your dog's organs, right? Doing it at home, again, on an animal that you're familiar with should help a lot, okay? All right, so keep practicing. Murmurs. I'm gonna skip the cardiac output stuff because we don't care. We just don't care. And then your picture, you guys answered this perfectly from yesterday. Your arteries do have a lot more muscle to them. What was the thing we wanted to remember about the veins? They have those stupid valves. They do. Otherwise, that's what we wanted to know off of this one. Again, you know all of this stuff. Remember the trick question from yesterday? We're talking about arteries. They always carry blood away from the heart. Whether or not it's fresh or not depends, right? So generally, arteries always carry fresh blood away from the heart, except for in the case of our pulmonary circulation, right? Where we have our pulmonary artery carrying bad blood away from the heart to where? The lungs, so that they can have that gas exchange. So you do want to remember that little trick question, okay? Arteries always carry fresh blood away from the heart, except for in the case of the pulmonary artery that's carrying bad blood out of the heart to the lungs, okay? And then same thing with veins, right? Veins generally are going to be bringing blood, well, always bringing blood, bad blood, back to the heart from your systemic circulation. Again, except for in the case of the whole lung situation, right? Where we have the pulmonary vein bringing fresh blood back to the heart. Okay, so the directions don't change, but whether or not it's fresh, oxygenated blood or bad CO2 heavy blood, okay? I know, I'm sorry there's trick questions, but you do want to make sure you have a handle on that. Okay. Does anybody remember what we kind of said clinically about the vena cava yesterday? So we know that, yes, it's the entry point for all the bad blood into the heart, but what did we say about it clinically in terms of what I would use that vein for in clinic? Mm-hmm. From what species?
Pigs.
Very good. And guinea pigs. So the vena cava is the site of choice for venipuncture in the pig and the guinea pig. Again, if you have that down pat now, you won't need to remember it or learn it again in large animal. One thing we haven't talked about as far as drawing blood is kind of how, I guess, you'll get there. But generally, you draw blood kind of like this, like kind of parallel to the vein or vessel. With the vena cava, you're stabbing straight in. You're not going like this. And it's because it lies so deep that you kind of stab straight on like that. And then capillaries, you guys already know. Capillary beds make up fair majority of all of our vasculature, though they are only one cell thick. This is where the action happens, right? And gas exchange takes place on the capillary level. Okay, our trick question. As far as the blood vessels go, you already have all that, I think, down pat. You know your largest artery, again, is the aorta, and your largest vein is that beauty the vena cava. Let's skip over that. All right, so you guys tried to take a pulse, and that's awesome. That's great. Your tactility will be something you will need to continue working on a lot. Any waitresses? Okay, try not to let your fingertips get burnt from here on out. I know it's hard, try, okay? Because your tactility, the fingertip feelings are gonna become very, very important. For some of you guys that weren't maybe able to feel your pulse, it might just be because your fingers are dumb. I mean that with love, but they're dumb. They've never had to touch something so fine before. They're used to just grabbing big stuff, not feeling a tiny little cat vein, right? So you have to train your fingers, just like you're training your brain to study, you have to train your fingers. And that's, again, starting to really feel up any animal pulse that you can, right? Even when you go to your grandma's house, you bend down to pet her dog, feel his pulse up, feel it up, get some practice, right? You'll remember that we said yesterday the way that we were gonna learn this in terms of ausculting and pulse palpation is to do it together, right? So that we hear what we're feeling and it should be perfectly synchronized. Sometimes it's not, right? Yes.
Sorry to interrupt. How many students total in this class?
Oh shoot, 21. What did I have?
The path was already on that one. And Caitlin had her copy from school that didn't have the path so that they can draw the path.
Oh, well, that's fine as far as that one goes, but you had the other sheet with the write-outs, right? Okay, perfect.
Yeah, I'm just making a copy for the
For the
for
key.
those who want to draw their own path.
Perfect, perfect. Thank you so much. I
Yes, mate.
didn't even notice.
And because I'm a dude, how many did you say?
21.
All right.
Thanks.
Thank you.
So you do want to be able to auscult and palpate the pulse at the same time. When you're practicing at home, don't try to do both. Okay, pick one, auscult or palpate. One, because you can't restrain your animal, listen, hold, and feel at the same time, right? That's just a little bit much for you to practice at home. But when you get to school and you have somebody restraining for you, it will be a little bit easier to, feel the back leg and listen with both of your hands, okay? Again, we're wanting to rule out any possible pulse deficit that could signify to us either a heart condition or a blood pressure or perfusion problem. Okay, so that's what you're gonna learn in school anyway. Whether or not you do that in practice will be up to you. I feel like once you learn it that way, it's hard to not do it. Like, why not just feel the pulse too, right? Again, ausculting is not enough. Okay, ausculting does not tell us anything about perfusion or blood pressure. Okay, that's where we really have to feel that pulse too. Okay, again, what is auscultation telling us? Yeah, it's giving us a heart rate, but what is it telling us is happening inside the body? Okay, that it's pumping.
It's working as it should, the valves. Movement.
So let's go specifically to the valves. When we say what are our heart sounds, the lub-dub is the valves closing. That's what auscultation is telling us about what's happening in the body. The valves are closing in your heart. That means nothing to me. I mean, it means a little bit. But blood pressure, perfusion, the ability to oxygenate, all of this is a lot more important than if the valves are closing right? Okay, so that's why pulse is so important. We covered this a little bit yesterday. So small animals, little Chorkies, are gonna have really fast pulses, really fast heart rates. The Great Dane's gonna have a slower heart rate because he's bigger, right? And then the cow and horse, even slower still. Okay, so that's the same with the heart rates, the pulses, etc. Okay, so again, the smaller the animal, the faster things are working. Okay, and then our blood pressure. Again, we talk about blood pressure and actually have you guys perform blood pressures in emergency, but it is just, again, appropriate to go over the connection between the systolic contraction of the heart and how that's represented with our blood pressure monitoring. Okay, and then same with diastolic. Yes, it's important. We don't usually care about it, really. It's good to know, but in terms of how humans do, one number over one number, we don't do that. Okay, we don't do that. The mean arterial pressure is something that's a little bit more important in terms of the information it provides, because it's giving us an average of that. Now, do you remember from yesterday what we said kind of is the magical number when we're talking about systolic blood pressure? 80. Yeah, right? Oh yeah. That was a guess. What happens to my body if my blood pressure goes below 80? Okay, so yeah, what specifically will? Organs will start failing. Organs will start to decrease in function and fail. Is that good? No, of course not, of course not. So we do want to remember that magic number of 80. Guys, honestly, generally speaking, you're not ever waiting. Like, you're sitting here watching the monitoring box and you're like, I'm gonna wait till it gets to 80. I mean, generally when it hits, if it's been running at like 115 during surgery or whatever procedure, and now it starts just tanking and tanking, I'm gonna do something before it gets to 80, right? Okay, I just wanna make sure that's clear. So like if it's dropping and it gets to 100, I might intervene then. If it's dropping and it gets to 95, I'm gonna intervene. I'm not waiting for it to get to 80. Okay, cool. Just making sure we clear that up. And then the two different types, remember the Doppler is the one that I really, really like, and it's the one that I prefer. I think that it is clinically more accurate than some of our computer digital methods, though we do use both. A lot of times in surgery, we do use both. I do like the Doppler better because again, you have that sound. There's just something to hearing it and not just seeing it on the screen. And again, I do think that it's a lot more accurate. You know, we are placing a little ultrasound crystal directly over the artery, where this one we're just using a cup. So I do think there's a little loss in specificity of the results with that method. You guys will do both. You'll learn how to do both. Okay. And then all the other things we can do to check out the cardiovascular system. Again, a lot of it is related to the heart, but not all, right? Some of our vasculature is important too. EKG, just recording of the electrical conduction in relation to what chamber is firing when. Again, you'll learn that all in emergency. The echocardiogram or cardiograph we talked about earlier is a way to double check the murmur, right? To determine what kind of problem with the valves are we seeing. Okay, so the echoes are really, really cool. And then you have the Doppler echo, where you can not only see but hear in real time the video of the heart. All right, this is where we left off. So on animals, there's lots of different places that we can poke them and get blood out of their bodies. So on here we have every single animal, and their ideal venipuncture spot is the jugular vein, right? Is that on a ClinPath exam? Is that ClinPath? Is that from? All right. So the jugular vein, very, very important site for venipuncture, right? It is your number one go-to, but not if you don't feel comfortable drawing. That's where you have a couple other veins that you can use. So the arm vein in both our dogs and our cats is the cephalic vein. Do you remember what cephalic means? So ick is pertaining to the cephalo is head. Cephalo is head. So remember we had sternocephalicus? Sternum head? Okay, just making sure you're putting it together.
There's the brachiocephalus that runs.
Brachiocephalic is arm to head.
Okay.
Arm to head. So cephalic vein means pertaining to the head. That makes sense if it's my front arm vein, okay? Because it's the one that's closest to my face. Okay. Oh. Muscle. Oh gosh, I shouldn't have done that one. A little T-Rex move. Yeah, what's wrong with me? And then we have in the back legs, for dogs and cats, it's the same vein, but it's different sites. So we have our saphenous vein. On this dog, it's the lateral saphenous, so it's on the outside of the leg, down lower than I just touched. And in the cat, it's the medial saphenous. They have up here femoral vein, or the medial surface of the femoral vein. We don't ever call it that. It's the saphenous vein. Medial saphenous, because it's on the inside of the thigh. And the saphenous on the dog, it's down low on the hock, if you'll notice. And then in horses and cows, the jugular vein is the optimal site to draw from. But in the cow, you do have the coccygeal vein. And in large animal lab next semester, you'll draw from all of those sites in all of those species. This semester, you'll probably just be working with dogs and cats. Okay. The thing about venipuncture is you have to know your anatomy, right? You have to know your anatomy. If you know that the cephalic vein is supposed to be right on the very front side of the arm, and you can't hit it, or you can't feel it, or you can't see it, you're gonna still need to stab. Because again, anatomically, you know where it is. You know where it at least should be, right? Yeah, there are these freak of nature animals who have their vein like clear laterally for some reason. But for the most part, and I find this true maybe more with the jugular vein, is that people won't even try if they can't see it. And again, maybe you can't feel it because you don't have good tactility yet, because you're still working on that. That's dumb. And I will not let you get away with that in lab. I don't care if you can see it or not. Okay? Because again, anatomically speaking, the jugular vein is between your mandibular symphysis and your lateral mandible. It is right there. Okay? So again, if you know where it should be, and you've got your trachea coming on the midline here, don't poke that. And you know it shouldn't be any more lateral than the fattest part of their jaw, you know what area to poke. Okay? And we'll go over this again in lab, you know, with live animals when you guys get there. But I feel like so many people are just so afraid of the jugular vein because they can't see it. Here's the thing, the jugular vein is supposed to lie in the thoracic groove, right? It's not always gonna stand up for you. It might not always, you know, really dilate when you occlude it. So again, just go for it. You know your anatomy, stab it. Stab that animal.
Is it not normal to use the femoral vein for a dog?
So we don't, one, because in a dog, this is a lot more sensitive. So that's why we generally use the saphenous. Now I will say in the dog, to get an arterial blood sample, you do need to draw from an artery, and it usually is the femoral artery. Same thing with an arterial blood draw. Venipuncture is like this. Arteries like this, because my arteries are very deep. Why? Because they're the most important ones carrying fresh blood all over my body, right? You will do arterial blood gases if you work in emergency medicine. Otherwise, probably not so much. But yeah, it's just a little bit more sensitive. In cats, they don't seem to mind the medial saphenous. Some do. Some just mind being alive, I feel like. But for the most part, cats really don't, they're not too bothered by this. Now I will say in really chunky pets, that vein's gonna be buried. So you, instead of, you know, going perfectly parallel, you might be angling a little because you have to go under so much cat fat to get to the vein, right? The big thing I think about venipuncture too, and I think I actually heard Dr. P say this to you guys at one point, if you can't draw blood on an animal, it's not your fault, it's your restrainer. That's true though, that is true. Drawing blood is stupid easy, guys. Restraining the animal perfectly and appropriately, not as easy. So, you know, we joke about it, you know, being the restrainer's fault, but like, really it is. Really it is. So don't take offense to that. You know, it's not necessarily, you know, one of those things. But I will say, you know, if you're told to, you know, hold off differently or re-roll or, you know, try this instead, don't take offense. Just try it. Just do it. Because again, we're just trying to get this job over with together, right? But I've had some people who will get really offended when I ask them to re-roll. And it's not a mean thing. I'm not trying to be mean, but you have the harder job, re-roll please. I'm just standing here with a sharp thing. This job is easy, okay? And that's really how I want you guys to think about blood draws too. Drawing blood is not hard. It is not hard, okay? Restraining and occluding appropriately so you can see your vein, so you can feel your vein. That's my job and it's hard, okay? All right, so you guys will get to this point sooner than later. But venipuncture, other reasons that we poke the vein, usually it's to get blood out, but sometimes it's to give IV medications, right? Sometimes it's to place IV catheters and that kind of thing. So again, having your handle on the veins anatomically will help you so much when you're sitting there with a dog and his leg is covered in fur and you're like, where do I even, right? Again, remember your anatomy. The cephalic is gonna be on the very top, Again, why? Because it's closest to the head, okay? All right, so I think that's pretty much the basics with that. And that wraps up our cardiovascular system, guys. So we finished it. Make sure you have chapter 15, respiratory, somewhat skimmed for tomorrow. So it's gonna be a fast-paced day tomorrow, I'm warning you now. Okay? All right, have a great lunch break. I will see you a little after 2. If you're done at 2, I'll meet you at 2:10, okay, to start intro. Okay.
Yeah, so when you